to introduce our closing speaker. As I noted in my opening remarks, the state of reform bridges healthcare policy and practice. And we started out the day with the practice side of the equation. And now it's time to turn our attention to the policymaking colleagues that are a part of the partnerships that we've been talking about throughout the day. Bob Ferguson is the Attorney General of Washington. He received his law degree from NYU, returned to Washington to clerk in Spokane for Eastern Washington Federal District Court. He was in private practice in Seattle as well before, and we cannot wait to hear his comments as he takes the stage. So please join me in welcoming Bob Ferguson.
Thank you so much, Kathleen, and thanks to all of you and all the folks who put together this wonderful conference. It's great to see you all. And let me start by saying that I'm acutely aware of the fact that the only thing standing between you and the reception that follows this conference is this speech. And so I'm going to promise, I think they've given me 30 minutes. I promise I won't be taking 30 minutes. We'll all be done well before 4 o'clock, so you can get back to that important part of the conversations. That is an important part of a conference like this. So that's my first promise, number one. Number two, what I want to mention before getting started is, the perspective I'll be sharing is that of an attorney general. You are all experts, right, in your areas when it comes to healthcare. I do not pretend to be an expert, right? I have a certain role in state government, and our role in our office is an important one. We have about 800 assistant attorneys general, about that many professional staff, and 13 offices all around the state of Washington. One of our attorneys, Eric Nelson, is here with me today. My chief of staff is here, Mike Webb. As an office, these issues are obviously very important to us, serving our clients, and then the people directly. But I don't pretend to be an expert, but have a certain lens on the issues that you grapple with on a regular basis. And so what I'm going to try to share today are a few issues that my office is very involved in, that intersect, I suspect, in some ways with much of the work that you do. One last thing I want to say before I get started is that I'll be at the reception afterwards. I'm not going to miss the reception. So if you've got questions, feedback, I look forward to that afterwards. Again, like with Eric and my chief of staff, Mike. So feel free to grab us afterwards. And really, your input and feedback is important to me and to my team. And we get that in many ways. Mike and I just came from a meeting in our office with someone in the industry to talk about healthcare. There's someone somewhere in this large hall. His name's Hugh Ewart. His daughter and my daughter, they're both 15, play on the same select fast-pitch softball team. It's a team that plays year-round, basically, in tournaments all around. We're in the same carpool to get our daughters to practice. So Hugh's here, and he and I, once in a while watching our daughters play fast-pitch softball, might even talk about healthcare there as well. So whether it's on the softball field as parents watching our daughters play, or in my office, or here with all of you, your feedback, your input is really important to me and my team, and look forward to hearing more from you soon. So let's dive in on a few issues that I want to share from my perspective as Attorney General. And I think what I'd focus on is that many of the diverse issues in healthcare boil down to access. Access to providers, access to the full range of healthcare, including reproductive healthcare, which I'll touch on in a little bit, and access to recovery services for those who need it. Now, in my time as Attorney General, that has certainly been my focus as well. So the issues I want to touch on briefly are work we've done that has a direct intersection related to the opioid epidemic, the fentanyl epidemic, cases we brought and dollars we're recovering for the state of Washington that can be used to help folks who are in the grips of addiction. Our efforts to ensure and expand access to our state's medical financial assistance laws. That's both on the policy side, so calling reference to the policy side, and on litigation side. We're a law firm. Sometimes we bring lawsuits to enforce the state laws that we have that are meant to protect Washingtonians. I'll also mention another law. It's a first in the nation law to ensure health data privacy, which protects access to reproductive and gender-affirming care. And then lastly, I'll talk about legal efforts to make sure that we're protecting and enhancing access to a full range of reproductive health care. So let's dive in. So look, I am confident, I don't have to tell anyone in this room for sure, of the devastating impacts of the opioid epidemic and the fentanyl crisis. And hopefully I'm not repeating a couple statistics that you've already heard earlier today or that you already know, but Worth noting, a recent Seattle Times article last week mentioned that King County alone saw more than 1,000 overdose deaths from fentanyl in 2023, which surpassed the previous year by 47%. In 2013, there were just 3 fentanyl overdoses in King County. Opioid overdose rates, that's not unusual. They're increasing, as you know, all across the state. So for example, between 2002 and 2004, the rate of deaths involving opioids was 5 people per 100,000 in Pierce County, to take that county as an example. Between 2020 and 2022, essentially 2 decades later, that death rate jumped more than 340% to 24 per 100,000. And again, those trends are similar statewide, as you know. What's key in all of that is the desperate need for more resources to help individuals, and that we're woefully underfunded in that regard for the many needs that we have for the folks who are struggling. So according to the State Department of Health, 25 of our 39 counties don't have an opioid treatment program within their borders. I think that issue was even talked about earlier today. In Washington's jails, which have a high rate of opioid use disorders, only about half reported starting or continuing medications prescribed to treat substance use disorder. There are many examples, of course, but those give you a sense of scale of the problem. The problem is getting bigger, and our programs to tackle it are desperate for resources. So AGs have a certain role, right? We can hold accountable entities that don't play by the rules and harm Washingtonians. So we've been very active in taking on some of the largest corporations in the world. These are literally Fortune 15 companies in some cases, where in our view, these companies violated the law in pursuit of profits and fueled the opioid epidemic. I'm not going to, in the interest of time, detail those cases, but all I'll say is the conduct of those corporations I find to be shocking of what they were willing to do in pursuit of profits and the harm that was caused. We've been very active in these cases. I've rejected national settlements that other AGs accepted, taken cases to trial, got our own resolutions. So far for Washington State alone, my team's recovered more than $1 billion, that's with a B, more than $1 billion from those cases. Now, there are many great things about being Attorney General, but one of the best things about being Attorney General is that if you reach a resolution in a case like that, I get to decide where that money goes, essentially, right? So in the settlement agreements with all these companies, in those settlement agreements, I insist that we write into those agreements that the money can only be used by the state or by local governments. Half the money is going to go to the state, half to local governments, more on that in a moment, can only be used to abate the opioid epidemic. We give them flexibility within that, but that's the only way in which those dollars can be used because the need is so great for services related to the opioid epidemic. And I just will add also that, we're not done. We have more cases that have been filed. We'll be announcing a resolution to a significant case soon. And again, I won't decide where the money goes. That's left for experts, right? That's where folks like you come in. I'm an attorney, right? That's not my job. But I will just say as a potential action item for at least some of you, if you care where that money goes, engage with your local government. They're going to decide. Those local elected officials will literally decide where that money goes. They've got to work within a framework that we're providing to them, but they have a lot of flexibility. And we encourage you to reach out to them. To give you a sense of scale of the amount of money, and again, more resources we expect will come in, but King County and its cities will receive more than $56 million over the life of the settlements. Clark County will see more than $14 million. Spokane County, more than $19 million. Just to give you a sense of scale of the dollars we're talking about. Is it going to solve the problem? Of course not. But we hope that this will make a significant difference in helping Washingtonians who are struggling with addiction. I think we know we can't just treat symptoms, and that's why we've worked hard to help ensure that every Washingtonian has access to affordable health care. So we have a team in my office that ensures that healthcare providers are following our state's laws. And our state has important laws that ensure that access. It's kind of commonly referred to as our charity care laws. That's the name of these laws. And so state law protects access for low-income Washingtonians for accessing healthcare, both insured and uninsured patients. And hospitals, as you probably know, are required to be proactive in asking folks if they might qualify for this assistance and to screen them for eligibility, that there are affirmative obligations on hospitals to do that work. And if a patient appears to be eligible for that financial assistance, hospitals must suspend any collection attempts and give the patient a reasonable opportunity to apply. That's the law we've had in Washington State. If you don't follow that law, you're going to hear from my office, right? We have a team that enforces that, and I want to be clear that I take that law very, very seriously. Laws are important. They're only valuable if they're enforced, and this law is an extremely important one. I won't go into the details of litigation we've had, but we've had cases that have been resolved where hospitals have not followed this important law. And to give you a sense of scale, we had one case that resolved in 2017 where in the end the hospital had to provide $41 million in debt relief. In other words, there was $41 million of debt accumulated from people who should not have had to pay because they qualified for financial assistance. They also had to pay millions in direct refunds to people who actually paid money for their health care who should never have paid. We had another case, a separate case, debt relief of direct refunds of $13.4 million to more than 15,000 low-income folks. So these numbers are very, very large. You can see why we take these cases so seriously. And so that's an important part of our office, right? We enforce these laws. Now, what I want to add to that on the positive side is in doing that work, it became clear to me that this law we have to ensure access to low-income Washingtonians to health care they need was woefully inadequate and way too restrictive. I'll give you an idea of how restrictive it was in terms of who qualified. So if you were a single parent, so this is before, I think 2 years ago we got this passed. I'm looking at Mike, but I think 2 years ago it got passed. So before a change in state law 2 years ago, which I'll get to in a minute, if you were a single parent working 2 minimum wage jobs at 50 hours per week, okay, you were not eligible for charity care. Seems a little restrictive to me, right? And so when it became clear that that was the case, we set to work as Attorney General. I can propose changes to state law, just like the governor can or other statewide officials. So in the 2022 session, I requested legislation to significantly strengthen and expand those laws. Tara Simmons, state legislator, was the prime sponsor on that. It was a huge, if you know her, thank her. She did a great job on this. And I want to say the Hospital Association was a key partner on this legislation. We always reach out to stakeholders, folks be impacted by legislation we're proposing, and I'm just so thankful that the Hospital Association could have said, no way, we're gonna object to this, we're gonna testify against it. No, they partnered with us, saw the need for us, and really without their support, we probably could not have got that across the finish line. A bill like that to expand access in a very significant way would typically take many years to get passed through the state legislature, but thanks to a coalition we had from so many folks, including some people in this room, we got it passed through the state legislature in our first attempt. And so now the number of folks who have access to charity care has expanded dramatically. So for example, if you're a family of 4 on a salary of $80,000, you receive free financial assistance for their health care needs at most hospitals. And so it's a huge help. About 50% of Washingtonians are now eligible for free or reduced cost health care, which has now turned us from one of the most restrictive states in the country to one of the most expansive when it comes to making sure that folks have assistance as they're seeking health care. And maybe I'll mention 2 more things briefly that relate a little bit to privacy and reproductive health. And one is that I think we can all agree that your personal health care information should not be used against you by whoever holds it. And in the wake of the Dobbs decision that, of course, overturned many years of precedent related to abortion care, when that happened, we began, along with legislators, taking a look at state law in Washington State to see if there were gaps in our state laws where maybe in a world in which Roe v. Wade was the law of the land, those gaps weren't so significant. But in a world in which Roe v. Wade is overturned, those gaps could have significant consequences for many Washingtonians. And I'll give you an example of one that, frankly, was a little bit shocking to me, which was, as you know, many people now use apps, for example, for all sorts of things, including personal health information. It is not uncommon for individuals to use an app, for example, to track their period. Apps are very common. Well, guess what? There are no HIPAA protections if you put your personal health information on an app. In fact, the owner of that app can sell that information or give that information away without your consent to whoever they want, even though, and this is just one example, even though they hold deeply personal health information that you have. They can turn it over to a prosecutor in Idaho who might want that information. So the consequences are profound. So we propose a change to state law to essentially protect that information. So that information cannot be turned over to law enforcement or sold to anybody without your consent. And again, we were able to get that law passed through the state legislature. So making sure we're protecting people's personal information is critically important. Vandana Slatter, Fresh State Representative Slatter, and State Senator Manka Dhingra helped lead us on that effort and get that legislation through the state legislature, including some folks in this room. And that's called the My Health, My Data Act. I think it's the first in the nation kind. Other states are interested in that and trying to follow that as well. And that's the kind of thing I think we need to be doing as a state to make sure we're protecting information that folks have. All right, the last thing I'm going to mention, thank you, appreciate that. And the last thing I'll mention is it's related to a legal case that's in the news related to reproductive freedom. And this relates to mifepristone. Mifepristone is the abortion medication. More than half of abortions are actually done through mifepristone. So for example, in Washington State, I think it's about 60% of abortions in Washington State are from individuals using mifepristone. It's a very common, ubiquitous medication for the people in our state and all across the country. Mifepristone has been the national news. There's a case before the Supreme Court on it. So I was going to just share a little bit about it because it's topical and impacts so many Washingtonians as well. And by the way, it's an example of, while Washington State has laws put in place by the people through the initiative process to ensure access to the full range of reproductive freedom and through the state legislature, there are still lawsuits that can happen in other states that can result in limitations to that health care. And this is a really good example. You may recall that about a year ago, a lawsuit was filed in Texas. And it was filed in a federal court in Texas. And what the lawsuit sought to do, they asked the federal judge to ban access to mifepristone, which is regulated by the FDA. They were asking this federal judge not just to limit and ban access to mifepristone in Texas, rather they were asking that federal judge to ban access to mifepristone nationwide, so including Washington State. Now, federal judges have broad powers and can issue national injunctions. They can do that. Why they filed this case in this particular court in Texas? Well, I will tell you why. Because in this particular court, unlike, say, the Western District of Washington, where we are now, if I file a lawsuit, there's lots of federal judges in that district, and I don't know which judge I'm going to get. Could be a judge who's considered liberal, or a judge considered conservative or moderate. You get the idea. Could be a Democratic appointee, could be a Republican appointee. I don't know. In this particular court where they filed this lawsuit, there's only one federal judge. You know exactly which federal judge you will get. And this federal judge had written extensively before becoming a federal judge about his opposition to abortion and the full range of reproductive freedom for women. So they filed it there, seeking a national injunction. So when that case was filed, it was pretty clear this judge really might issue a national injunction on mifepristone, which would have catastrophic consequences for people here in Washington State. So I met with my team. My team is an incredible team. They're very experienced at litigating at the national level against administrations. They've done it many times. They win almost every time. Now, I wasn't exactly optimistic we could do much. Washington's not a party to that lawsuit, right? I can't just show up in Texas necessarily and, right, we're here in Washington. But I asked my team, I said, is there anything we can do about this threat to mifepristone in Washington State? So I don't think the team was any more optimistic initially than I was, but they said, well, think about it. So they went and they came back, and they said, after a few days, we thought over it and we have an idea. And I said, great, what's the idea? And they said, we have an idea that we could file our own lawsuit against the FDA here in Washington State. And I said, well, I'm not quite sure I'm tracking, right? There's already a lawsuit against the FDA saying that mifepristone should not be available. And they said, well, that's true. What we could argue is that access to mifepristone should be expanded. And the reasoning is that mifepristone, interestingly enough, is one of only about 60 medications, 60 drugs, approved by the FDA that have limitations on their access. So these 60 medications and drugs tend to be highly dangerous, okay? Powerful drugs used for psychiatric patients, for example. You can imagine fentanyl, for example, right? Used only in very circumscribed situations. Well, mifepristone even though studies show it's safer than Tylenol, is still on this list of limited access. Now, in the interest of time, I'll spare you the details of why that is or what those limitations are, but those limitations are not insignificant. And so the team said, look, if it's been around for decades, it's safer than Tylenol. Those limitations still imposed by the FDA, while they've loosened over the years, are not grounded in science. No federal agency can just make stuff up, right? They can't just place limitations arbitrarily. They gotta have a basis for it, and there's no longer a basis to limit access to mifepristone. So we would be arguing that those limitations on access to mifepristone are unlawful, that they're arbitrary. Kind of a brilliant idea, right? And so no one else, by the way, was suggesting this theory out there, even though this case was getting a lot of attention in Texas. I did say to my team, I said, well, I've got one question. I said, does Viagra have any limitations on access to it? No. So I said, make that point before the judge. So we filed a lawsuit in Eastern District of Washington. 17 states joined us, right, in our case. So 17 states wanted to ensure access to mifepristone, joined us. And the day in Texas, when that federal judge issued that national ban on mifepristone, he did it. That same day, our judge, federal judge in Spokane, issued his own ruling saying, no, for Washington and these 17 states, access to mifepristone is going to remain in place. We're going to ensure that access here in the state. Now, that case in Texas has gone through extensive appeals, and where it's at now is before the U.S. Supreme Court. The U.S. Supreme Court has accepted it. And the Supreme Court has said, while it's thinking about it, access to mifepristone is going to remain in place nationwide. What it's also done is it said it's not going to consider banning access to mifepristone nationwide, the Supreme Court. But what they're going to decide is whether or not the existing restrictions, which are not insignificant, okay, should be in place, or what the restrictions were back in 2016. So I mentioned earlier, it's been made more available. The restrictions have been eased over the years. So the choice is, at what point in time, which restrictions apply? Well, to give you an idea, this is not some academic exercise. If you go back to 2016 for the restrictions on mifepristone, here's what those restrictions improved. Here's what those restrictions include. You will need, if the Supreme Court goes back to 2016, in order to access mifepristone, you will need 3 clinical visits would be required. 3 of them. No telemedicine prescriptions would be allowed, unlike it is now. Right now, you don't have to appear in person. You can imagine the impact on folks in rural communities as one example, let alone folks in the community right here. And it would only be available through 7 weeks of your pregnancy, not 10 weeks. Those are some examples of what's before the United States Supreme Court. Pretty profound implications for access to mifepristone, not just for individuals in Texas, nationwide. And so, that access to the full range of healthcare, including reproductive care, is why we're fighting on this issue, why we're involved in this lawsuit, why we're making sure we're fighting to ensure that full range of reproductive freedom, which I think it's important to point out that more and more sort of forces outside the borders of Washington state can have a profound impact on what's available here in Washington state. A judge in Texas, a Supreme Court back in Washington, D.C. can have impact right here in Washington state, even if we have laws on the books that put those protections in place. So those are some of the issues that as an Attorney General that I'm thinking about, that we're working on. And at the reception, I'm looking forward to hearing more of your feedback on what those will be, and happy to take any questions. And while I'm not an expert in healthcare issues, I am an expert on 16 and under fast pitch softball. So I'm happy to take any questions you have about that. If you've got a daughter who's involved in fast pitch softball, I want to meet you and talk to you about that. It's a big part of our life and a big part of my daughter's life as well. Thanks so much for having me. Thanks so much for all you're doing for healthcare in our state. I really appreciate it.